Good morning. I'm Mark Stewart from Econometrica, and I'd like to welcome everyone to day one of the Home Health Quality Reporting Program, or HHQRP, provider training. A few housekeeping announcements as we get started. Restrooms are located out the doors to your right and then turn left. Closed captioning will be provided all day. It can be seen on the screen to my right. There is a table reserved if you would like to move closer to read the closed captioning. If you should need any other reasonable accommodations or have any questions throughout the day, please see me or one of my colleagues in the yellow shirts who greeted you this morning, and they'll be throughout the room. On your table are polling devices, which will be used throughout both days. We ask that you please be sure to leave the device on the table at the end of each day. We will take questions throughout both days. We encourage you to please watch the presentation to see if your question may be answered during the presentation, and if not, to please ask it. There are three ways you may ask questions. There are cards on the table. We ask that you please complete your name, organization, section number, if it's relevant, and then write the question. Staff will be moving throughout the room both days to collect the cards. You're also welcome and encouraged to use the microphones to ask questions of the presenters. Please use the microphones. This session is being recorded, will be posted to the CMS YouTube channel, and in order to properly record the questions, it's best if they're asked from one of the microphones. The third way to ask questions, and probably the easiest and certainly the best for us, is to submit the question online, and I'll walk you through that process in a few minutes. That allows us to collate the questions throughout both days, sort them, and show them to the presenters, because real time, they can then review the questions and work on responses. When you checked in this morning, you should have signed in order to receive a certificate of completion, and you were given a folder. The left pocket is the agenda for days 1 and 2. The right pocket is all the materials you'll need throughout both days. At the back of the right pocket, just before the evaluation, is a list of acronyms that will be used throughout all the presentations. The speakers and faculty have been encouraged to say the acronym the first time for everyone. On the tabletops, you have specifications for the pressure ulcer measure. You have the cards that I mentioned for asking questions, and you also have a hard copy of the instructions to submit questions online. If you looked at the slides before you came to this session for HHQRP, you noticed the answers were missing. That's by design. Following the sessions, you will receive a complete slide deck with all of the correct answers, justification in the case of the case study for that scenario. So you will receive a complete slide deck afterwards. This is what we'll cover today. Overview, and here I get to practice spelling out the acronym the first time. Improving Medicare Post-Acute Care Transformation, or IMPACT Act. We'll then cover the HHQRP requirements, definitions, and assessments. After a break, we'll cover data submission and reporting. Later today will be pressure ulcer, M1311 and M1313, and we'll end with questions and answers. Our first speakers before the break will be Dr. Alan Levitt from CMS. and Kathy Roby from Qualidigm, and I'll do their bios in just a minute. Later today, we'll hear from Jen Pettis, Apt Associates, and Ann Spinard, also from Qualidigm. As I mentioned, all the materials with the correct answers will be posted to the CMS website following the training. Both days will be recorded and will be available in the future on the CMS YouTube site, and certificates of completion, as I mentioned, will be emailed to you, so please be sure to provide your email address at sign-in. This is how you may submit questions online. You can click on this site if you have your laptop, or access it obviously from cell phones. It's 2017. We asked again that you enter your name, organization, email address, section if it applies, and the item number. The main thing I want to request is that you just submit one question each time you use the form through your phone or computer, which allows us, as I've said, to sort of sort them and show them to the faculty throughout both days. After you click the submit box, you'll see this screen. In blue, it says submit another response. You would click there to ask a subsequent question. We have an icebreaker activity. I don't know if you're all tables and from the same organizations, but we thought we'd get started with everybody having a chance to greet one another and share a little bit. So if you could please introduce yourself to your colleagues at your table and finish the sentence. If I had to describe myself in 3 words, they would be, pick 3 words and explain why. I won't model the way, but I'll let you get right to it. Thank you for doing the icebreaker activity. Our first speaker who will give an official welcome on behalf of the Centers for Medicare and Medicaid Services is Dr. Alan Levitt. He's the medical officer for the Division of Chronic and Post-Acute Care, or DCPAC, the Centers for Medicare and Medicaid Services, or CMS. He received his medical degree from Albany Medical College and completed residency in internal medicine at Hartford Hospital. Dr. Levitt was on the faculty in the Department of Medicine at the University of Maryland Rehabilitation and Orthopedic Institute, and he's a former member of the Board of Directors. Dr. Levitt is responsible for the CMS quality reporting programs in nursing homes, skilled nursing facilities, inpatient rehabilitation facilities, long-term care hospitals, home health agencies, and hospices. He'll be followed by Kathy Roby. She's a consulting director for home health care at Qualidigm. Ms. Roby specializes in teaching and educating nurses, focusing on improving home health provider clinical outcomes and reducing acute care hospitalizations for Connecticut home care providers. Prior to her current position, Kathy was Director of Compliance and Reimbursement at New England Home Care Incorporated. She holds a master's in healthcare administration from Hartford Graduate Center. There's a Connecticut connection here. A master's in education from St. Joseph's College, and a bachelor's in nursing from the University of Connecticut. She's a certified home and hospice care executive and a certified trainer for integrated chronic care management. Dr. Levitt.